Well, what had been an impasse between the Public Hospitals Authority and the Consultant Physician Staff Association is now in the past. A milestone moment has been reached for the first time since the body was recognized as the official bargaining agent for senior doctors. P.H.A. Murphy has a story.
After years of contentious negotiations that led to senior doctors withdrawing their services at one point, the Public Hospitals Authority and the Consultant Physician Staff Association have signed an industrial agreement. Details of the agreement that was more than 3 years in the making were revealed at a press conference at the P.H.A.'s office Wednesday morning. The 5-year agreement is retroactive July 1, 2016 to June 30, 2021. Although the value of the agreement was not shared, Minister of Health, the Honorable Dr. Dwayne Sands, says it includes a base salary increase, lump sum payments, and an increase in extra-hour allowance.
P.H.A. recognizes that fair labor agreements have the potential to create higher wage and benefit standards, working hours, and working condition parameters. It also has workplace hazard protections and other factors. Union agreements can also promote employee well-being by encouraging democratic participation and a sense of community among workers at every level.
The Minister of Health says there are many vital elements to a successful healthcare system, but the clinical professionals who practice medicine are the most important component. Over the years-long negotiations, concern for senior doctors range from health insurance, challenges with the healthcare system, and senior doctors not receiving a raise in 10 years. President of the Consultant Physician Staff Association, Sabrika Pinder-Butler, says the CPSA is committed to delivering quality care, but must be a part of the decision-making process for healthcare.
This theme was central to our industrial agreement, and once actualized, will ensure that this standard of care is not only sustainable, but that it continues to improve in the future. Our members were generally pleased with the salary improvements and the agreements related to the implementation of group medical insurance and the provision of a physician lounge. Although senior physicians have been without these provisions for many years, we appreciate the current economic climate in our country with the hope that with time, this will improve all around.
She says the body that represents 120 senior doctors now expects the new industrial agreement will allow for equitable treatment of its members employed with the P.H.A. and the Ministry of Health.
We are all servants of the public every day, even though senior doctors are often excluded from benefits provided to public servants without justification. Moving forward, however, we expect that this practice of exclusion and discrimination to discontinue.
Chairman of the P.H.A. Julian Roll called the agreement's formalization a major milestone in the continued development and redevelopment of healthcare delivery in the Bahamas.
We look forward to continuing work with our consultant physicians to ensure the quality of hospital care delivered to our patients in all of our institutions to ensure the future development of healthcare in the Bahamas.
Sands says the industrial agreement now brings consultant physicians in line with increases across the public service. Negotiations on a new industrial agreement will begin in 2021. P.H.A. Murphy, ZNS Network News.